Good morning. How are you? I wanted to bring something to your attention because anything that I come across where I might have to intervene and help someone that might not know how to help themselves in regard to this um, matter. Um, and I really don't know how to say it, but what I find is this is in regard to Social Security. Okay. What I find is some of these local agencies, the local Social Security departments, not the Washington D.C. the big gun, but the ones that they distributed in your particular area as your field office or whatever, where people can go and apply for benefits, get Social Security cards or whatever, to get questions answered or all this type of deal. I'm finding that, at least here in Columbus, Ohio, here is again an issue with the employees, the people that are working there. Again, it is not the overarching entity. The overarching entity would be the Social Security Administration that has certain mission, certain vision. They have, policies and protocols and regulations and things like that, and certain workflows and standard operating procedures and approaches to how they do business. All right. And it's all outlined and it's very strategically done because of what they're doing and the way that they're doing it is based on evidence-based research that tells individuals this is what, of their entity, this is what, equates to a more effective and efficient way of doing business. And it basically can serve populations of people in need of particular services a lot better. All right. So the overall arching entity, this is the same thing when I talk about employers and anything like that. This is what I talk about with the courts or anything out here, the overarching entity itself that laid down the rules, regulations, policies, standard operating approaches, and all this type of stuff. They're doing what they're supposed to do. All right. It's the employees, it's the people not going and referencing what the company, the overarching company, or whatever has outlined for them as the expectation. What is the standard? What is the guideline? All right, we rolled out the blueprint for you as the overarching business entity. We put a CEO in place and things like that to ensure that these operations are the things that we said. We put these policies and all this type of stuff in place to ensure that, you guys as employees, those frontline, what do we want to call them, like the busy bumblebees, at the forefront of, our mission that's actually, putting it into action out there. And for instance, with the Social Security, with the populations of people or the consumers that we're attempting to serve, right? I really do talk fast, but anybody can get in the comments and ask questions or, say whatever you want to say. But a lot of things relative to what I'm speaking of. And if you're not understanding, please do tell me, hey, slow down on your videos. Usually, I'm not really coming on here to present some type of a developed curriculum where I outline any type of student learning objectives and things like that right now. What I'm trying to do is just come on and give quick tidbit alerts of things that come to me. So I just recently had to help someone with an issue with the Social Security Department, right? And the other day, I put a video on here trying to give you some insight. If you are an individual that does not really know how to advocate for themselves, or you don't have someone like myself in your life to advocate for you on your behalf, or give you insight and information and stuff like that to help you at some point become self-sufficient and be able to self-manage certain things and advocate on your own. Okay, because I said what? You are your own best advocate. That is absolutely true. All right. If you have somebody like me in your life, then you should be thanking Jesus, okay? Because I'm rare and I'm the bomb and I am an asset and I do care about people, period. I don't even have to know you, but I read or see something about your situation and somebody harmed you, made you cry or made you hurt, made you lose something, put you in a hardship. I would get very, very mad as if you were part of my family. I get so mad. I really do. Like I'll ball my fists up. I'll be ready to jump up and knock the shit out somebody that did something to you. Seriously. And I don't know where that comes from. I don't even have to know somebody for real. I'll get on these videos, I'll be watching stuff. I'm like, no, they didn't. What the fuck? No, they didn't. And I oftentimes see people and what they go through. If I actually go through comments or I know like where they're from, and you know, whatever what's going on with them, I'll write something anonymously. Mhm. I'll write something like I was acting like I was in and stuff like that. And I'll put on people's reviews and stuff like that. Like, you know what they did? This place did. Yes, I will. Or I'll call someplace. I'll call someplace. I'll look them up. Like if somebody says they've been harmed or whatever, I don't care what it is. It's easy to Google and search businesses and shit like that. I'll go and I'll call the damn business. I'll be, excuse me. I know you just didn't sit up here and tell her that she had to do XYZ, bitch. And I'll hang up. Sometimes depends on my mood. If I feel like being silly. Uh-huh. Forgive me, Jesus. I have done that before. I don't keep on calling and harassing them. But if it makes me very, very mad, yes, I did it. I did it before. I will admit that. But I usually try to be very professional. But there was a lady, and she was in the Somali community. And I will tell you that individuals that are not from here, um, you know, people are really not from America, people will try to take advantage of them. Now, she speaks good English and she does a great job of communicating and all this type of stuff. The issue lies with some people from alternate cultures when they come here. It's not so much about being able to speak the language. Sometimes it's being able to read and write the language and or comprehend it. So that's where the issue lies with a lot of people. That's what I'm finding. That's what I find out when I'm just be out here talking. Well, this particular person's landlord, property management, was harassing her and her family, and the woman also had an autistic child. And I have an autistic grandbaby, and I'm getting sick and tired of people sitting up here wanting to target and abuse individuals with developmental disabilities, whatever, or you know, some type of functional limitation, whatever's going on, violating ADA and their rights all the damn time, and nobody doing nothing about it. Mental health. There's another one that's if people have qualifying mental health conditions and stuff like that. And people take advantage because they think anybody with a damn mental health so-called diagnosis is walking around all day looking cross-eyed and like all fucking day and shit like that. Okay, that's not okay. Half of these people out here got mental health diagnosis and shit like that, schizophrenics and all smarter than your ass. So stop fucking with them, okay? Damn it, I'm here now. Y'all done woke me up. Okay, you done poked the bear far many times. I said, your time is up, wrongdoer. Damn it. And we're going to get out here. We're going to do some advocacy. And we're going to bring the awareness. And we're going to give you some tools and tips and education of life on how you can ultimately begin to do what? Advocate for yourself. And then once you learn it, you're going to carry it on. You're going to tell somebody else. You're going to pay it forward. So the cycle continues. All right. And we change things. All right. Anyhow, yeah. So that girl was telling me about, we'll get into the social security shit here in a minute, but she was talking about how the property manager was talking to her very disrespectful and being mean to her and talking down to her. And the only reason why she's doing that is because she's not from here. She's Somali. All right. She's being very nasty and rude because people think that because, you know, you're in a low income status or social and economic status, or you might be a foreigner, you're not here, you know, weren't born here, something like that, you might need a little extra explanation or explaining, and so that they think you're dumb and they can talk to you and treat you in a way because they're holier than thou. They fucking mean something. You ain't nothing but a damn property management person, bitch. You only making $16 an hour. If that, who the fuck you think you are? You don't be talking to her like that, damn it. That's I don't play. Fuck that. And then and it's a it's a reason why God put me right there during the time that I was right there. I was doing some administration work over there as an administrator for this little daycare thing, trying to get this woman shit together for her because she was up against the wall with her quality measures and shit like that and whatever the fuck. And I could tell why. When I was there, I could tell why. She needs a lot of changes and that woman, her daycare's a whole piece of shit, and I should do a video on that. I might. I'll tell you, I was exposed to everybody, honey. That lady got teachers up there snatching and pulling on kids. One of them teachers screaming and hollering, "No, stop it, get over here, get over here, go over here, go on and come out." Pushing on that little boy, acting all crazy shit. I'm like, what is the deal? Like, girl, you can't be doing that to that boy. And I had to have a conversation with the teacher. I mean, the owner, who calls herself a supervisor, but she says she don't want people to know she's an owner because somebody might come up there and shoot her. She said, like, girl, I mean, what? Shut up, damn it. I mean, her and her husband own that piece of shit, okay? And they need intervention, not turn them into, I'll turn you in. If you're fucking around and you're putting people at risk, especially vulnerable populations of people, which are what I said before, that's usually your low income status individuals that must qualify for these assistance programs and all this type of shit. And some may have functional or mental, physical types of limitations or whatever, whatnot, developmental disabilities, whatever it is. Yeah, I'm advocating for those group of people and or anybody that may have a lot of money or may have had their life was all together, everything was fine, but they fell on a hardship or a crisis at some point that was unforeseen. So people don't take into consideration these people either. Okay, and their life is a complication. Lots of times there's crisis, unforeseen crisis in people's lives. That's second to not lots of things. Number one thing being like trauma or something tragic, maybe a fatality, and whoever the person was, a matriarch or patriarch, or whoever it is of the family dynamics, may have lost their life, or they might have a new normal subsequent to a catastrophic injury or something like that, and then that significantly decreased their financial contribution to the household. I mean, there's a lot of things. People lose their jobs. You got to wait on unemployment. Unemployment ain't nothing. It's only nickels and dimes, compared to whatever lifestyle you was living before, and you're undoubtedly not going to be able to continue it because you're not going to make enough to cover your mortgage and your rent and utilities and all those different basic needs, your food, your clothing, those types of things, your property taxes if you're paying a mortgage, I mean, insurance coverages. If you need a vehicle for transportation or your insurance and gasoline on that. If you don't have a vehicle, if you need to utilize public transit, I mean, it's a lot of things and issues that people get attacked with that might be an ongoing issue for them, but some things do come out the blue and folks just don't expect it, and it can hit them hard. And you are not immune, so you should keep that in mind at any time that you are trying to serve others or you want to sit back and you want to judge somebody else's life and what you're going through. You're not immune to it. And a lot of times too, it will be some of these unforeseen tragedies and traumatic events that spiral people down so bad into a very bad mental headspace, and where they need mental health intervention. It could be crisis intervention, mental health crisis intervention, or some type of intensive, maybe like an intensive outpatient, or some type of approach to get them on a pathway to doing better with some therapeutic interventions and coping mechanisms and things like that, right? So, like I said, I know a lot about what I'm about to talk about, mainly because I've go through it every single day in my own personal life, and I've had to strategize through these things and figure out a way to just make it for myself personally, but also for individuals in my immediate family, like my children, my daughter-in-law, my grandbaby, all of that. And I've always my entire life helped people in the community just by giving information long before any extensive amount of education or anything like that. Just life skills, just having to go through something in life, and having to know and having to be forced really to learn how to utilize different assistance programs or how to kind of pay Peter to pay Paul, how to, flip something, take something on that you think ain't nothing and turn and flip it and sell it or do whatever you got to do to make a couple of dollars to do this and that, I've had to do that. I literally used to, which is an actual good resale tip for anybody out there. I used to frequent thrift stores and stuff like that. And you can go into these thrift stores and you can get things, they mark them with those wax markers or whatever. But you literally can bring those things home and wash them. And what you need to get is a Brillo pad, a little soapy Brillo pads. You can get them at Dollar Tree. That easily removes that marker shit off of there. And then you wash it, remove the marker, wipe it off real good. And you can repost that stuff on Poshmark. You can put it on Facebook Marketplace. You can go do you a pop-up tent with a table or something like that. Lay those items out like yard sale or miscellaneous items and things like that. I've had to do that. I've had to go to a it's like a big flea market type of a thing. They turned this drive-in into a flea market thing, and you could go up there, you could pay like a little measly $5 maybe, and you could sit there out there and you set your tables and stuff. But people go out by and buy. I've had to do that, and then yard sales, everything. Because you just have to figure it out. I have to sell Avon. I mean, so I just had to do certain things in my life to try to make things, work out. And I have utilized assistive programs. for what I needed them for the time being. I've had to go back to them, so I've had to utilize a WIC before. I've had to utilize the SNAP program. I don't think it used to be called SNAP program though. The food stamps I used to get them when it was in the book, but I also have a food stamp card too, even to this day. I still have a food stamp card even to this day because one time I had the books and then I didn't need food stamps no more. I was able to get a good job and stuff like that and lost the job. I had like an unemployment. I needed to go back and ask for assistance for the food stamps. And do you know, after all those years, they still expected me to have that same food stamp card? I was like, I don't have it. They said, "Well, you're gonna have to go. You can order one." Excuse me. He said you could order one, or you could go out there and pick one. Pick one up. I was like, oh my God. So that's what I did, and I never got rid of it. I still have it because you never know. Anyhow, basically, I got off a topic. The topic of the day is Social Security, right? If you are trying to seek Social Security benefits and things like that, you need to stay on top of their ass, okay? Don't just trust any and everything that they're telling you. It's just involving y'all, and that's just how it is and shit like that. Just like anything else, it oftentimes have to get eyes on agencies. I don't care if it's a federal agency or not, because many times it's not even the agency itself, it's the employees, right? So a lot of them are unqualified, they're incompetent, disorganized, and don't a bit more have at the forefront of their mind of advocating for you. Now, see, I would feel like someone in the Social Security disability department should have a compassion, and like some type of a sympathetic bone in their body when they're trying to serve these individuals, right? Because most people are very vulnerable that are applying for Social Security benefits and stuff like that. Something is qualifying and or what I'm finding is not really part of the standard operating procedures of the Social Security Department for their representatives or case managers or whoever to um, tell people what their options are. You can tell people we have a policy that says, like this one here, right? There's a policy in place that's basically saying that if the Social Security Department owes you back pay, they're only able to disperse your back pay like in 6-month increments. Okay, that's what this is saying, pretty much overall, right? And it's just breaking it down, saying, yeah, basically, you're just gonna have to wait. We'll give you a little bit of your money, but you're just gonna have to wait. But what they don't tell you, what your caseworkers and stuff like that don't tell you, and what they should be bringing to your attention and also assessing for you is this part. What is the exception to those requirements? All right. So for you as a recipient, you can take the time to see if any of these things apply to you so that you can get more of your money up front. And guess what? If you're in a vulnerable population, these exceptions apply to you. It's like they apply by default. So that's why I don't understand why these motherfuckers even got this bullshit in place. All right. These people who are on SSI and all this shit are need a benefit to help them. 9 times out of 10, part of the reason why they need the benefit is because of what? These very exceptions listed here, because their unmet social determinants lie within these types of things: food, clothing, shelter, medical needs like access to health care, food, clothing, all this type of stuff, housing, okay, all these types of things that's included in the overall arching topic of healthcare, right? These things are unmet social determinants. I can't afford my medicine. Insurance doesn't pay for it. I need a durable medical equipment. Insurance doesn't pay for it. I need supplies. I need dressing changes, dressing change supplies. I have a drain or whatnot. I need certain types of tape for my skin. Okay. Of the other tape, it puts my skin integrity. It's it will cause a complication. If my skin gets ripped, hey, I got diabetes, I'm not going to heal. I'm going to end up with an infection, end up in a hospital, all this types of stuff. See, people don't think ahead. All right, this is bullshit right here. So I'm telling you now, what you need to do if you get one of these piece of shit letters that they sending in acting like they can't give you all your shit, you need to make sure that you go. And how you gonna tell me you can't give me my shit? Okay. And I done sat up here and I waited for all this motherfucking time. Okay. Because your pinhead, ice pick head, worker in there's ass can't answer the phone when I call. I done left 500 damn messages on the voicemail. They don't return no damn calls. Then when I call you, damn 1-800 is the fucking number. Shit. When I call you, damn 1-800-772-1213 shits. I'm on the line for 12 hours. Then at the end, it clicks me off, damn it. And I'm on my Obama free shit here. Okay. And I ain't got time for this. All right. I got other shit to do. And you just playing around and toying around for my life because I'm an vulnerable population. You really don't want to give me this shit. Okay. You really don't want to give me this shit. But it can help me. Right now, SSI is money that taxpayers really are contributing to, and I believe that's where a lot of people might have an issue with, people getting these types of funds, and so maybe some of the red tape and constraint is due to that. But nevertheless, when it is my money, it's been determined that it's my money that you need to pay me. Why do you have in place that you don't have to pay me all of it up front right away? What does that have to do with you? Why the fuck do you have that much control over the monies that you already said that you owe me? You said I qualify. You said for back months. So what this means is this is for back months. This means that my debts did not get addressed for the back months. So that means I'm in the hole. Okay, already. I don't got no food. Okay. I don't have clothing. All right. My shelter's at risk. I'm getting ready to be evicted. All right. Yeah. So my medical needs and services. Well, I can't access health care. Okay, I can't access health care. I can't get back and forth to the doctor, shit like that. I don't have transportation. I can't pay no Uber. I don't have a support system. I don't have a friend. I don't have a family member. I don't have a church. I don't have anybody. Anything I need in terms of accessing healthcare, like getting to an appointment or something like that, even, unless I'm mostly frequent in the ER now. I can keep on calling an ambulance come pick me up because I do have Medicaid and Medicare. I can keep on calling the ambulance. All right, you out there in the world talking about you need to address the high costs. Okay, and people are utilizing the ER as their primary practitioner. Well, yeah, I mean, because what? You didn't sit and you didn't talk to me and find out what my social determinants and stuff like that are. All right, maybe I don't have my social security money that would have gave me my shit back in back pay, and I could have paid it Uber person. Or I could have told my neighbor, like, if you take me, I give you $20. And if you sit there for while I'm going through my appointment, I give you a couple extra ducats or I'll buy you something. That's what give me or do something. Okay. So you shut the fuck up, Debbie. All right. I didn't have no money for food, clothing, shelter, medically necessary services, supplies, equipment, or my damn medicine. I've been without my medicine for over 30 days. For all this time it took you to get my benefits prepared that I need. And now I need my medicines and stuff like that. And you're trying to say I can't have all my money. You're gonna dictate how much of my shit you're gonna give me. Who the fuck you think you are? That's part of the complication. They want to control people and shit like that. You said the money is mine. You said I'm owed the money, but then you gonna tell me when you're gonna disperse it and how many first and second installments of my shit. When I got rent to pay, I got property insurance, I have utilities, I got gas, electric, heating, fuel, water, sewer, garbage, mortgage payments, and our property tax. And here goes some more for you. People out there in the universe, you need to stay on their ass. These things you have. Don't ever accept one of these Social Security administration letters that's dictate to you when they're gonna give you your shit. You gonna tell them, listen, I need to implement the immediate request to have this reviewed. I need another installment because I got all this shit going on right here. Okay, I got it all. Okay, I have all this going on right here. You also can utilize your Social Security benefits to attend to your level of entertainment. Okay, these things you can use your Social Security for. They didn't put entertainment in here, but you can actually say that you do it for entertainment, especially if you're a payee of a child's money, because your child, you need to give them activities and entertainment and things like that, and those activities might have associated costs with it. I was paying over my boys' money back in the days because their father was killed in a motorcycle accident. They didn't get paid under SSI though. They got paid under SSDI. So SSDI is a little bit different. It's not as many constraints because it's not taxpayers' dollars. It's the actual account of the individual that passed away that they paid it to. So it's a little bit different. I also have a son now that had a psychotic break, so he gets SSDI. He's still paid under his father's account, so it's a little bit different. It's more than the average SSI individual with taxpayers are paying, and then there isn't those types of constraints on his assets and stuff like that. Yeah, they don't have to monitor all of that like they would if you were SSI. Anyhow, back to what I'm talking about. You get a letter, and like I know someone that has a letter, okay, and that's what sparked me to talk to you. All right, first of all, let's backtrack. First, let me finish this and tell you. So, if you ever receive a letter that's telling you that you get a lump sum back pay, and they're only going to give you XYZ $2,000, just to say, for example, they're going to give you that. They're not going to pay you again for 6 months, and right before they get ready to pay you again, they'll send you a letter and tell you, nope, right then and there, you traipse your ass into that damn Social Security Department and number, you sit there and wait if that's what you want to do, or you take the better route, like I told you in an alternate video, right? I said what you need to do is you need to request assistance from whoever your senator is. All right, here in Columbus, Ohio, it is Sherrod Brown. You can go online, and if you know, the only complication that I find, and I hate to keep saying you can go online and all that, the only complication I have is with individuals who will never see this video ever in life, that will never know that they can go online, that will never know that Sherrod Brown actually advocates, they'll never know there's a real form that will get results because they're not on social media, they're not on YouTube, okay, anything like that. They don't have a support person, they don't have somebody that can just run into them on the street and say, hey, you doing okay out here? What are your needs? Do you need me to help you with anything? Tell me a little bit about what you're going on, what's going on with you that I might be able to help you with quickly or whatnot. You know, I can meet you at the library or something like that. I can come to your house, sit down with you, and make sure you get some of these things completed. I can sit at the computer and ask you questions. You can tell me what needs to go in here and how you want me to say it and do it, or whatever, so you get the help that you need. They don't have nobody like that. See, that's what I'm getting ready to do. That's part of my mission. That's also part of my community outreach and effort. I just have to have the capital for it because it costs to be doing all that travel and all that type of stuff. And, yeah, but there's a true need for that. There's a true need for just an advocate. Even just to, I mean, honey, I will tell you, my phone probably be ringing off the hook just for people that really need somebody just to come and read and explain something to them, what it really means, and that they can trust is not tricking them. That can just come over and help them fill out forms and get things put in that they can trust and not tricking them nor trying to steal their identity. Because a lot of these forms require your social, and you know, if they get into your business a little bit, they might require like a bank statement upload or something, you know. So you gotta have somebody really, really that you can trust. And especially your senior population, they're very leery about that. And so, you know, and it's really sad that there's all these wrongdoers and con artists and shit out there because it hinders people who really need help. They don't want nobody in their business, honey. And I'll tell you, that's a geriatric population for sure. No, they don't. They want to know like, what's that? And they know about the scams that y'all be out here doing. Yes, they do. But now it's so bad that if you talk to somebody that's geriatric and you're really trying to help them or something, like, what? Now what is this? And why are you calling me? I don't need that. I didn't sign up for that. What is this a scam? Like, yeah, so people do it all the time. Oh, oh my God, I love that population so much. Oh, but what was I saying? Okay, anyhow, just know that I'm saying that that's something that it's something in my heart and that I want to do as a part of my community outreach or my community advocacy type of a business. I have the business already. It's an LLC. I want it to be a nonprofit because I don't want any cost to the people I'm trying to serve, right? So in the interim, while as a LLC, I don't have any capital. So that's hindered me, you know. So I just do what I do like this is to get on these social media sites and give information free by way of free mechanisms and stuff. And just hopefully I can reach people and then people tell me stuff. What's going on with them in my inboxes and stuff like that. And I get to advocate for them on the back end as much as I can. I said, well, excuse me, I send out a lot of emails and yeah, I get on the phone with people and shit like that. I currently got something going on right now here in Columbus, Ohio, because there really is no rental assistance for the homeless prevention programs and shit like that out here, but they keep on advertising that there is. And it's a whole lot of constraints and red tape. It's a lot of bullshit, it's a lot of cover up and illusion that's being created as if these grant funds and stuff like are being utilized the way that these entities are actually telling the funders and the stakeholders being utilized and how they plan to carry out their mission and objective, right? Mission and vision. But they're not doing it. Some are doing it, yeah. They're doing a good job of it, but some others are not. And some are doing it specific to certain resources. And then the others are failing. Like, and again, it's not the overarching entity, it is the employees, okay? It's the caseworkers and case managers and stuff like that that are either not qualified or they're not licensed or they're just downright lazy. They're Googling sites and stuff like that and just typing in any other thing and sending them to people that really don't even need it. Like I said before, I know somebody who has an autistic child and a so-called caseworker was just Googling stuff on Google and sending it to them like school supplies and all that types of the person. The child is autistic for nonverbal and does not need any school supplies or anything like that currently. So I don't understand why this so-called caseworker was sending this. It makes absolutely no sense. It's because they're being lazy and the only thing they're doing is meeting their in-house job performance metrics for themselves to get whatever bonuses and things like that that they get for meeting any complex case management type of thing. Where their accrediting bodies and oversight might give incentive for meeting certain types of specifications and measures, right? That's all they're doing. I worked in several roles and I did it deliberately. I know all the shits, the ins and outs. I know exactly what you're doing in there and how things work. I came over to your job and I worked here for a while. I wanted to see what's going on, do an investigation. Yeah, I'm working here, but I'm really doing an investigation. I want to see what's going on. Oh, okay. Is that right? Is that what's really going on here? Okay, so it's copy paste. You guys have a whole thing set up like in your OneNote with a whole list of different copy paste things that you could just throw over in somebody's care plan or something like that. Oh, that's what you do. You're not genuinely individualizing. Or you just copy pasting because it actually will pass whatever the metric is for like accreditation or NCQA, and they give you large kickbacks. Yeah, so it's a lot of shit. Okay. But I wouldn't work in these places of shit like that. I already know. I already said. I did it on purpose. So I could come back out here and help you. I had to go do it. I had to go do it myself. And see what's going on the inside and come out here and say, oh, okay. So I can come out here and tell you how to get around that and how while they fucking around, they playing checkers. You're gonna play chess. I said it 100 times. All right. So and I know what I'm talking about. This is why I'm currently developing something where it's actually a project that I'm working on, but the project itself is helping me develop what I need to develop for my nonprofit. And when I get ready to truly write a grant proposal or something like that, or come to the table with somebody that might have an interest, an angel investor, or anybody that may say, you know what, I see what you're doing. If I give you X, Y, Z, a little bit of money, how do you think you immediately put that to use to serve the community or something? I got the answer. I have the answer to that any fucking way. Period. Off the top of my head, I got to show you shit that I wrote. Yeah, it comes easily for me because it's innate. It's a passion. It's innate. It's deep within. It's not that I'm making up anything that I've scripted because I want to go before a grant some stakeholders and funders and I want them to give me the money. So I'm making up all this shit that sounds good. That's not that for me. And I recognize the bullshit. Because it's not that for me, I can recognize when people are making that part of what they're saying. Like I will tell you, you will always see in like healthcare, you will always see these same types of things. What the entity is trying to work on. What they're trying to do is they're trying to promote the health and wellness of people, right? Community population. They're trying to reduce the risk of complication. Okay. They're trying to educate and provide what resources and community linkages. Okay. And referrals and whatever to the population of people that they're serving, right? To do what? You hear it and you know it and you see it everywhere all the time. To optimize the outcome of the patient, right? To optimize health outcomes. That's what everybody puts because they know that that's what you should be doing. That should be the focus and all of that. But some people are only putting it there and saying it because they know so. Then they know that's what's going to get them the grant money and stuff like that. And then there's no true oversight for a lot of these agencies like nonprofits or whoever's putting in for these grants. There's no true oversight once the allocation of funds have been given to go in and actually do quality assurance checks and audits and things like that. We need to take a look at this particular process that you have going on. All right, so impact community action, you have a process in place for processing homeless prevention, rental assistance applications. And can you walk me through that? Oh, okay. So you have a phone line. You do in person. Okay. So and tell me a little bit about that. Okay, the phone line. Okay, that's the number. So when people call, every time they call, each and every time they call, never fails. Sun up to sundown, for consecutive days and 15-minute increments from 10 different telephone numbers of 10 different people calling and things like that over the course of like 14 days. Nobody got an appointment. So the phone line like doesn't matter. You start calling at like 11:59 p.m. and then that will make it the next day once 12 a.m. hit. And people just keep calling back to back to back to back to back. Like I have somebody tell me they call like 52 times back to back to back to back and never, and it just always says, we're sorry, our appointments are taken. Our appointments fill up quickly every day and all this. No, that phone line is a fake and it's a fraud. And all it is an illusion for people to think that they're genuinely processing rental applications and stuff like that on a daily basis, and that their appointments is going away so fucking fast because they're so fucking busy down there. That's a lie. It's not true. Okay, not in Columbus, Ohio. It's absolutely not true. It's a complete lie, and I turned them in. All right, so yeah, they need to audit it, and I say that when I turn you in, I'm gonna say, hey, there's an investigation needs to be done, an audit needs to be done, and I tell them, listen, somebody needs to go in these places and they need to assess what's going on. They need to do whatever surveying and or interviewing and whatever reviewing of the records and all this type of stuff and getting feedback, even from the employees that are already there, everybody on board, and then come back with some recommendations on a true initiative to get some quality improvement in place here. We need a quality improvement plan, right? So somebody needs to walk up into Impact and unannounced and just say, all right, can you pull me all the records of the phone call? You said that you have people calling in here on that phone line, and that's how you process your rental applications. Can you go ahead and give me the list from the phone line? How are you retrieving that? How are you retrieving it? So it's an automated thing where people can just push a button and it will schedule them? All right, how are you retrieving that data report? Give me that data report from the phone, how it's transferred from the phone to something that you're able to grab and know what people are coming for their applications or what time and shit like that. What date and what time and all that, right? How many do you take? How many people? How many people? Oh, okay. Give me every last one of those records. Okay. Do you know they're going to be over there at Impact looking cross-eyed, looking dumb like, oh, we don't have them. Okay, because that phone line is broken. They're not taking any calls and shit like that. Okay, they're not going to be able to provide it. All right, and the rental assistance applications that they have processed are more than likely just the ones that are down there at the actual eviction court. Okay, so somebody is sitting down there at the eviction court. Now, what they would do at the eviction court is then they would go ahead and pay your back pay and 3 months ahead or whatever. They actually do help you out in that regard. So that's more of the housing stabilization aspect of the homeless prevention program. But what we're trying to do is ensure that there is no eviction filing on somebody's name, because what does that do? That hinders them from getting housing in the future, number one. All right, so it's a change in process needs to be done. The processes are not effective and they're really not efficient. It's a misuse of the grant funds and shit like that. People need to stop donating to them, and these funders and investors need to stop giving the money and stuff like that because they're faking they're faking the fund. They're telling half truths, they're flipping the narrative and stuff like that, and they're making shit look good on the paper. So if somebody from the grant place called the number just to be checking real quick, it would seem legitimate. All right, because that's the illusion. Okay, no, somebody needs to be out here doing on-site pop-up visits at these places and doing true hands-on audits. That's how we used to do them back in the days. I mean, that's what compliance is. You have to actually pop up on the scene. Say, let me get some records. Just randomly grab me like 30. Okay, doesn't matter. Randomize, doesn't matter. All right, just give it to. Thank you. I have a sheet here of what I'm looking for. That all the specific specification criteria that I'm looking for, that this record must meet, specific to rental assistance, specific to food stamps, specific to Title 20, specific to WIC, specific to whatever, you know, even in the healthcare environment. If you're doing HEDIS, like I work in HEDIS sometimes, medical record review. All right, I need to have all these records, and the records just come in from the providers and the specifications. We're looking for people who participated in certain types of programs or have been identified through the claims data, like insurance and NCQAs over managed care. So in insurance, you have claims data. So claims data, what are these providers and stuff like that submitting to the insurance so that they can get the payments and stuff like that. So you can easily draw out the data from the claims report. And the claims report will pull out individuals and stuff like that and put them into certain categories that we're looking for. All right, like complex case management, what else? Comprehensive diabetes, there's medication reconciliation, transition to care. No, I don't think medication reconciliation, that's in the transition to care measure, right? I think. Yeah, so there's a lot of different care for older adult. So, you know, there are some back end checkpoints and compliance and quality checks that are in place. And the same type of approach that NCQA has in place for like their HEDIS with their managed care companies and making sure that providers are doing what they're supposed to do. And whatever evidence-based practice it says is best for them to do, that ultimately results in better outcome for the patients. All right. Everybody needs to take that same type of model. Like NCQA needs to develop their own model of quality twit checks or quality assurance and stuff like that. Just develop a model that could be implemented in any arena. Yeah. Okay. Because I believe that model could be effective anywhere. It's a very effective model, in fact, for managed care companies. Mm-hmm. Yeah, and so I believe that anybody could incorporate a model like that to make sure that their processes are going on. And in fact, if you're a grant company or a funder or a stakeholder or just an angel investor or something like that, that might be part of what you want to make as a requirement before you give somebody funding. You need to say, we need to see what quality check mechanisms you have. What model? We need you to develop a quality model. We want an actual model, which is just a standard approach. It's just standardized approach. So specifically, investors and funders and stakeholders need to say that. They need to put that in their thing now. I mean, really, I really believe that because I'm seeing it's a true issue. And at the end of the day, the vulnerable populations of people they're supposed to be serving are just not being served. So we need to make sure that you have something standard in place in terms of how you are ensuring that your processes and stuff like that equate to quality, because we're going to hold you to it. Because if we get a complaint or some type of notice that XYZ is not going on, or a person complained to you and they can demonstrate that they complained to you that, hey, this phone line is not working, everything like that. We want to know what was your investigative process relative to that, because then that would be outside of what you said in your quality model or your standards that you say equate to effective and efficiency as far as meeting the needs of the community specific to rental assistance. Your phone line's not working, nobody can ever get an appointment. awareness. So somebody told you about it. Maybe you didn't have the awareness. Somebody told you about it. So you have to do an investigation. Let me see what's going on. Maybe you got to call for yourself first. Get a couple people on board, do your own study. I've actually conducted a study. Okay. All right. So yeah, with 10 people, okay, 10 different phone numbers calling round the clock. I'm telling you, okay. And nobody for 14 fucking days, and nobody answered the fucking phone. Nobody got an appointment, nothing like that. And even still, it's still going on to this day. Then somebody outreached me in my IM and told me she's dealing with some bullshit with a damn landlord, and she had to turn in, and the city ain't doing shit and all of this, which they're not going to. And they're just faking the fuck with her too. And he's retaliating and doing all this type of stuff. She looked trying to find purchasing housing to get somewhere else because I got pictures. The ceiling is molded, mildew, and leaks, and she got open areas in the ceiling. She sent me everything, sent me videos, all kinds of stuff. People outreach me and tell me what's going on. And she said, yeah, I actually did get a chance to talk to somebody over there at Impact, and they said their phone line is going to open back up on September the 1st and the 15th. Well, when did your phone lines close down? Impact Community Action at 711 Southwood, Columbus, Ohio 43207. They're going to open back up. So they were closed. But you have people calling in acting like they could get rental assistance and shit like that, back to back to back to back. But you know what? Okay. So, and who's going to hold them accountable for that Impact? They're lying. But they got all this fucking grant money and shit like that over there, don't they? They don't have no rental assistance. In fact, the city of Columbus put some type of a freeze or a pause on the homeless prevention program right now, but ain't no alert went out to vulnerable populations of people. They got eviction notice in their hand or a 3-day notice if they get the premises. No, but did it. Okay. It's bullshit. Okay. But the community comes and they tell me shit. Okay. Yeah. So I'm a true advocate. Okay. So who want to give me some money to do what I need to do out here for the people? Because I'm really getting sick and tired of it. Oh, I'm telling you right now. They come and tell me, the people in the community come and tell me, and really all you have to do is ask. Okay. And to find out about the rental issue with the rental assistance and the Impact phone line, all I did was pose a question in a community group. I posed a question, just saying basically we get reports that, you know, there's issues with that line. I mean, anybody in here experiencing, and it was just like a plethora of responses. Everybody like, oh my gosh, yes, I tried to do this and I tried to do, and then somebody told me they called 52 times back to back to back. See, so we had to out them out on fucking Twitter. We got to reach out to some of their stakeholders and their funders and stuff like that. I'm already in contact with a huge stakeholder in a lot of the things that goes on actually in the city. Does a lot of funding and distribution of funds and stuff like that on a different matter that has to do with a disabled man in a vulnerable population of mental health that advocated for his rights as a disabled individual being discriminated against and filed complaints and is faced with retaliation, and they actually kicked him out of the community-based mental health place. This place is funded by grants and donations. Unless he did something to warn himself getting kicked out of there. Who do you think you are? It's a lady named Wendy Williams. She's a chief operating officer at Southeast Mental Health at 16 West Lawn, Columbus, Ohio 43215. She kicked him out. And what was found was actually they were billing his Medicare for services not rendered. So they said that they was giving him counseling services, which they've never given any type of counseling service whatsoever. There's no such sessions. They have no documentation of that. They have nothing at all. It's a lie. So they're actually billing for services they're not rendering to Medicare. That's Medicare fraud. So they're pissed off that they got eyes on them and things like that. They actually tried to revoke his right to participate in telehealth services and had to get eyes on him through HHS. And then they basically had to provide him with it. They said, well, we need to see him in person. But we said, well, okay, you can see him in person. Come on back. Okay. Yeah, and they were made to come over. They wanted to show that they was trying to meet his needs, but they're not really trying to meet anybody's needs. They're trying to control people, and they're not trying to ensure that their approach to care is patient-centric, which evidence-based research shows time and time again that your care approach, it must be and it should be and it better be patient-centric. All right, but there's no real accountability in place to make Southeast or Wendy Williams over there, Dr. Abdul Hassan, anybody take responsibility for their poor behaviors and actions. So we have to outreach a stakeholder and a big gun one too. And so we got in touch with the head the head in charge, and they told us to give someone a call over policy. And policy actually does matter. And so we've been kind of playing phone tag back and forth over that particular matter. But I did highlight for the individual that I have a lot of issues that I would like to bring to the table and allow you to have the awareness of, okay? And alternate entities that actually have the awareness of different complaints of discrimination, retaliation, rights revocation, all these types of things. They're outside of what standards of care equate to, outside of what clinical guidelines say you're supposed to do, in nursing practice or in just the medical field overall. It's against Southeast Mental Health is going against the grain as far as what the expectation of overall healthcare community is working toward. And the overall medical community is always their objectives and their missions and initiatives, approaches are always grounded in evidence-based research. Okay, the Southeast is not in line with that. And what they don't like is somebody like me that's going to bring it to their attention that you're going against standards of care. All right. And when you go against standards of care, you're going to find yourself being liable for lots and lots of money in legal claims and things like that, especially if there's a harm, an injury, catastrophic and or fatality that results from your actions. Okay. And they don't like that. And somebody like me, I document everything and I have everything. So I will undoubtedly tap that ass if you cause somebody to be harmed. Yes, I will. I'm not no attorney. And who I'm talking about in this particular case is my very own son. All right. And so as I advocate for him, his mental health feelings, at the forefront of my mind, I have the masses of the community in mind. Because if he's going through it and he has an advocate like myself, and I'm a Spitfire, just think about the individuals who are also going through it, but they don't have an advocate. All right. So whatever efforts I put towards to make a change for him, the ultimate goal is to ensure that the changes that are put in place for him affect all. Right. That's my goal in everything that I do. All right. So I said it 500 many times. I get on here and I act crazy and I be playing and all that shit, but really I'm not playing at all. There's underlying messages in here, and I got goals. And that's to ensure that this bullshit out here changes and vulnerable populations of people's get people's foot off their fucking neck. Okay? About time for me to go get me a coffee. I was saying something prior and I got off track with that. But anyhow, basically, you want to get this Social Security. Oh, I know what it was. So, well, from the beginning of this, anyways, this young lady. Oh, I was talking about impact, whatnot, and quality and all that. Yeah. So anyhow, let me just show you. Let me finish this and I'll show you something real quick. I'm actually in conversation with another type of a stakeholder in the housing deal. Okay. Because what we're finding in Columbus, Ohio is there is no actual resources available that they're saying are available. And we believe that money through grants have been allocated to them for specific to rental assistance. Okay. And they do not meet any type of crisis situation. So people who are in crisis, they don't make exceptions to get them like an emergency voucher, like right away. They don't have an exception for them to jump waiting lists at these different places that might have a vacancy. We actually have somebody named Kayla over at Gladden House say, well, first you have to call here. It's best to call the homeless hotlines. It's COHHIO. You call that hotline and they link you with resources. Well, what they do, depending on whatever you tell them, they'll link you over to Gladden House if you need home stabilization. So if you're in a place and you got an eviction letter or something like that, or you got an eviction notice and you want to stay where you are, landlord will accept the payment, you send you to Gladden House. They have a homeless prevention program. And they're supposed to be able to help you like pay their rent and a couple months ahead and do all this. Well, somebody over at Gladden House named Kayla, this is Columbus, Ohio, she said they don't do that. She don't do that at all. And they don't have emergency vouchers or anything because we actually know a family that is currently behind in rent, already being evicted, all this type of stuff. But their landlord, actually, the property itself is, he takes Section 8, but you already have to have your own voucher. So that particular family, if they get into the homeless prevention program that actually works, They could actually have their back rent paid to avoid being homeless and evicted. And then like 2 to 3 months paid in advance, because that's usually what they do. To give the people time to get up on their feet, maybe find another job or whatever that is. And then in addition to that, because it is known that the landlord actually does take the voucher, then you go ahead and process them for the emergency housing voucher based on the income and the status that has changed based on that. And then that way, they're where they're currently staying, they're no longer at risk of being kicked out. But then they're in a place that's not affordable because they have the housing voucher in place. And it's always good to just, advocate for the person, say, hey, and because you want things to change for them. You advocate for them and provide them with resources that might even help them find another job, places that are hiring, or equip them with some type of education. Like there's actually some type of program, it's a 5-week CDL program here that was initiated on behalf of the young man named Casey, who was police officers killed. It will provide individuals with a 5-week course where they can go ahead and get their CDLs, and it's all free. It's like, I think through Ohio Means, I'm not sure, but there's a lot of different apprenticeship programs and free trainings and stuff like that for people in vulnerable populations that they could take advantage of. But if you have a really good care worker and a really good advocate, it takes a lot of work because a lot of different things that you have to get in place for the person. A lot of different things. I mean, yeah, you really got to take on the case and manage the case. And back in the days, people used to. I still approach my patients and people like that. It's a holistic approach, and there's a lot of different things involved that you have to figure out for somebody. But you have to talk to them, you have to assess, and you got to figure it out. But when you're even providing assistance, whoever's at the forefront of that, they need to be also educated. At every point that somebody needs something, somebody needs to be educated. You just don't have them come in, fill out your paperwork, give them the rental assistance, and so cut the check to the landlord. All right, bye bye. No, you need to really be like, okay, so we're going to do this for you now. What's your plan for the next 3 months? We paid it up for 3 months. You got a plan in place? Are you going to try to get a job, or if they're disabled and they can't get a job or anything like that? What's the plan? Are we able to help you fill out for your Social Security benefits? Are we able to help link you with you know, some alternate resource, like for the housing part, if this particular person's already in a place that you can give them an emergency voucher, and they have a house to stay in, is based on their income, then you no longer have a complication with that. Are there any other social determinants that you need help with? Food, I mean, I can sit here and fill out the food stamp application and stuff like that. Also with pantries, if you have mobility issues, or we can make sure that you have a proxy on file. We get somebody assigned that can go to the pantries and stuff for you and bring the things back. Do you need a personal aid assistant in the home? I mean, what is it that you need? Do you need us to give a call to your primary care practitioner? And get an order in place and have to say that you're homebound and you need some type of skilled nursing, or you need home care? I mean, what exactly do you need? Or do you need us to link you with some other nonprofit? Like for your geriatric population, a great resource I like the senior options. I've linked so many people with senior options. Yeah, and yeah, believe it or not, and this is part of the service that I'm gonna be providing for people. People out here have reported that it is such a huge constraint, mainly the geriatric population of people, just for them to pull down their weekly trash can and have it done in the pull bag. There's some people that live by themselves, and they can barely get around. I mean, some of them got a rollator, some of them got their regular cane or quad cane or whatever, but it would be too much for them, too much of a fall risk for them to pull the trash can down and things like that. And I had a patient, she told me she's had this guy. I may have told the story on here before, I don't know. She's had this guy who's in the neighborhood, and everybody said, something mentally wrong with him and he just wasn't right and all this. But she would see him in the neighborhood all the time, and he would beg her for her cigarettes. And she'd give him a cigarette, but she asked him, "Hey, could you please take my trash can?" And he would. And then he'd bring it back up or stuff like that. And then she would let him in the house to get other little tiny bags of trash, like in the bathroom, bedrooms and stuff he put out there. She said some of her friends, her neighbors, like, don't do that. You don't want to do that, Hazel. She's not safe. Now he's going to might come in and do something to you, Hazel. That's what she was telling me. That's not her name. I can fucking tell you her real name. I don't remember it anyway, but I would tell you. But Hazel sounded good to me. Um, she said, yeah, she said, so then I started getting kind of scared. So she was so funny. She said, I started getting scared. And so I just told him, yeah, well, I'm about to go on in here and I got so many guns I need to clean. I'll never forget that. We had her laugh so hard. Oh my God. Oh, she's like, I don't have no guns. I said, you are so funny. I love her so much. I miss talking to her. And then my own mother, she said she was going to develop something that she stayed by herself too. She said she was going to develop something. People ring the doorbell. I said, somebody, so you can have this thought if you want to. I know how y'all out here like to steal ideas. She was going to develop something that when people rang her doorbell, it sounded like they cocked a shotgun, like, what the F you want? And then she said anybody can come by her house and run away. She lived in a neighborhood where there's a lot of individuals out there that was homeless, but she lived on the west side of Columbus, and there's some addictions and things like that going on. And people they'll come up to your door and knock and ask. And plus, if they know you, they know her, she's real nice and stuff. They come and ask her for like, you have a couple of dollars. This one couple, they live diagonal right across the street. They would come over here all the time. And one day I came over to my mom. She said, I think they're trying to take advantage of me and try to abuse me because I gave them a couple of dollars one time. When they asked, she said, but now it's kind of like they're making it out of a habit. Like every time I turn around, she said, shit, I got my own Social Security. I can't keep doing that. I say, That is one thing too, though. There's a fine line between helping people really and then knowing when you need to set boundaries because some people will take your kindness and try to run over you and stuff like that. Yeah, and then you gotta kind of put your foot down. And even with that, when you do that with some people, then they want to get an attitude with you because you kind of cut off their lifeline. But it's really like, you can't just do everybody like that. Like my mother was on Social Security herself, just trying to make them feel help you out every now and then. But when you're making a habit like every other day, you're over here like, oh, you got a potato? You have some peanut butter? Can I have a sandwich? You got another 10? Can I have a couple of your cigarettes? You got a beer? Like all that, like come on now. Now you're causing me stress with that. Okay. And my mother's not an advocate. She doesn't know anything about how she might be able to help those people. Like, listen, I can't keep giving you my money. But what I can do is give you a telephone number of a caseworker or somebody that might be able to help you. And also, this is what I do when I need X, Y, Z. Nobody is really going to just give you money and stuff like that to get your cigarettes and beer and wine and all of that, through any type of an agency. Nobody's going to do that, you know. So that part, they also have to figure out their own way on how to get that and asking people to get them a little ready job or something like that, because that's just never going to be part of anybody's grant program. Anyhow, I got off into a rant. We're going to get back to the Social Security. All right, the Social Security. I showed you in another video. If you have issues with it, never trust or believe anything that they're telling you in these papers and stuff like that, especially when it comes to the processing of your application and or the money that you know that you qualify for, and then they haven't given you the awareness yet, and you're dragging their feet. You can't get in touch with the caseworker, somebody being nasty or rude. You call the 1-800 number, you're on hold forever. It's hanging up. You're not getting anywhere whatsoever. You have to take initiative. You have to be proactive for yourself, right? So what you have to do, what I would suggest that you do in that case, you can go in there and sit down if you want to, but just know that the senator in your area should be helping you. In Columbus, Ohio, Sherrod Brown does a wonderful job of assigning a case manager or whatever to it. Look into it, right? So basically, it's a request us form, request for assistance form. You do have to download it. print it off and fill it out. But if you have Doc Hub, and you know how to access that, that might be an easier way for you, to do it. Unfortunately, you don't have me in your city to be able to come and help you, and I don't have the capital. But at some point, I'm going to have the capital. Yes, I am, to provide these types of services to make, life a little bit easier for you, and where you don't have to be burdened down with these, processes and forms and online applications and things like that, or, whatever. Go and look up your senator by zip code. Go see if they have a request us form. Here in Columbus, Ohio, there's a request us form. Sherrod Brown had the girl fill it out. She sent it over. The representative from Sherrod Brown's office outreached to Social Security Administration. Then all of a sudden, miraculously, they were able to say, "Oh yes, we had the interview." She sent in all the verifications and all this type of stuff. And oh my goodness, right away, 2-3 days, she'll have X amount in her bank account and all this and that. And then she'll have a letter explaining the rest of the details. So that's what the senator's office alerted or updated the person that put in the request for assistance, right? So the person has actually received partial back pay, and then they have the letter indicating what the monthly amount is going to be. And this is where I will tell you too, we'll stop right there. The caseworker, case manager, they lie. They lie a lot. Okay. This particular case manager told this girl who put this disability claim in for benefits for her child that she needed to send her in every single month her pay stubs. She needed her to send the pay stubs in every single month because the payment, Social Security payment, will be changing. Will be changing every month. Okay. Could change based on household or income to send it in every month. That's what that caseworker told her. And I was telling the girl, I said, that doesn't seem right. Why is that? I mean, that's usually not how it works. I know when my children were young and their father died and I got benefits and I was paid leave, it still was a certain allocated amount. They required me back then to, you know, say how the money was being spent to the benefit of the child. And a portion of the money you can use for like household expenses and stuff like that, but you can't use all of it. But you had to kind of outline what was going on. They asked you if any money's been saved or whatever. But every single month, that did not change. And so the monthly allocation, I just did not understand where that was coming from. So that particular caseworker is actually a liar. She's giving misinformation. That's not true. And you can see it now because a letter from the Social Security Administration has actually come, and it tells what the monthly allocation is going to be. And it doesn't outline any further type of specifications in terms of every month you need to send X, Y, Z. It just basically says blank blank's current monthly supplemental Social Security payment is X amount of dollars for whatever the month is. Blank will continue to get this amount each month unless there is a change in the information we use to figure out the payment. Okay, so but that caseworker was saying she wanted this person's pay stubs every single month. You see the lies? That's a lie. That caseworker actually needs to be turned in. And in fact, when this person initially sent in the inquiry, she did write that in there. She said she just kind of wanted a little bit more education and breakdown on how the process works specific to having a child with autism and the Social Security benefits under the PERK program, because it wasn't really explained to her. It just seems like there's a lot involved because the caseworker stated that she had to turn in her pay stubs every single month and do all this and that. That could create a constraint for somebody having to do that. Not only is it time consuming, but some people don't have the mechanism of printing out pay stubs and then sending them to the Social Security place. They don't have a stamp, or they don't have a mechanism. They don't give you an email. So then how are you going to get it to them? You have to mail it or go up there and sit and wait and turn it. That's causing a lot of problems. But it's not true. It's not necessary. You don't have to do that. And that lady is a whole liar. And that's what they do. They play on the fact that you don't have the information and you don't know and you don't question it. Because you feel like, oh, it's the Social Security. That's the government. Oh, that's what the government and stuff like that. No, it's not the Social Security Administration. It's these fucking employees that's telling you wrong. Okay. It's clearly that's not necessary. Okay. All right, so anyways, they got the letter, but then it says, well, we owe the back pay, right? X amount. We're gonna give you a little bit of back pay, and then you'll get XYZ every month. Right, every month. But we're not gonna be able to give you any more. Because the law says, guess what? The law says we have to give it in installment payments, right? The law says we have to give it in installment payments. Okay. But they don't tell you this part I said before. They don't tell you what the exception to the installment payments are. Okay. Now, these are a couple of the exceptions. If you're going to die within 12 months, you're not going to need SSI again. You know? All right, that's one. There's many exceptions, right? All right. There's more. All right. So these are the exceptions to the limitation on the second installment payments. If you're faced with these types of things, you can definitely ask them for what? Let's go down a little bit further. I'm not going to show you. Sorry. Okay. Right in here, what you want to do is you want to go in. Is this the one? This one. I'm so sorry. Basically, what you want to do, you want to go into the office, so you want to ask the senator. Here we go. To process you an immediate AOTP, right? So this is the example that they gave, all right? And they're just basically saying, listen, they owe him $10,000, right? But they can only give him the first installment of $2,199, okay? The letter told him what his payments, you know, blah, blah, blah. His letter tells him he can receive more of back pay payments right away if he has certain debts or expenses. Her letter does not say this. Most of these letters don't. That his did, because his caseworker was probably the bomb. But I don't know. This did not. Yeah, right. I have the letter right in front of me because it's actually my daughter-in-law for my grandbaby who's autistic. Okay. So this is why I tell you anything that comes about in my own personal life or somebody else's life where I've had to help them or read through certain things. I'm like, girl, you got a question, you know. So yeah. So that's what made me come on here today to tell you. I was like, oh, wait a minute, I gotta go tell my peeps, listen here. That's not how it works. And let me tell you, and then I'll come back on another video or something. I'll tell you how things turned out. So now she already has the contact at the senator's office. So what she's going to do is do a follow-up. She's going to reply back to the email. She's going to say, hello, Miss Such and Such. Thank you so, she already told her thank you, but thank you so much. I wanted to let you know that I did receive a payment in the amount of XYZ and I did receive a letter, but then they were telling me that by law, I'm not able to get the rest because of XYZ. Nevertheless, the case manager never did go in detail about the fact that I could get more of my back pay payments right away if I have certain debts and expenses. And so I had to go investigate, and I actually do have some qualifying debts and expenses, in fact, which include food, clothing, and shelter, you know, yeah, also medical necessities or like specific to the services like speech therapy, occupational therapy, physical therapy, transportation back and forth to these appointments. I mean, I have to depend on Uber or the bus that costs, or I might want to purchase me my own vehicle or something like that. You can do that too if you're trying to work in the best benefit of whoever you pay for or for yourself to get back and forth and do whatever and not depend on nobody. Your supplies and equipment, your medicine. For somebody that's autistic, that's not going to be on here. You need things that are specific to, you know, their development. And a lot of times that involves like some of these sensory devices and things like that. Or if you want to get a Wonder Wagon, if you want to get a crash pad, you know, if you want to get those types of things, and that if she needs sandbox and she needs this, that, and the other that help with her, she likes to touch certain things and sensory. All right. So we have to have a lot of these things. She liked the tunnel thing that the wheel, it's like a thing that goes on the floor and you go crawl through the tunnel. There's certain things she likes to go outside and she likes to walk, and we do grounding with her because she doesn't really like to wear shoes so much. So she will go out back, take the shoes off, and walk in the grass. And she likes to go over to the fence and peek through the fence because you can see a store on the other side. She just repeats she repeats. She's nonverbal to a certain extent. She doesn't communicate. She does more repeat. So it's she's a screamer and a pointer. All right. So she just basically repeats echinacea. Okay. So she just repeats shows and stuff like that. But she would say, "Hi, mom. Hi, dad." She's getting better. That's speech therapy on board. But she needs different things to make her well, right? And to keep her on track. And there are instances where a mother has told me she hadn't had money to get certain types of things that she needed. We're getting things in place now. You know, the child is not going to go without. However, if she has these benefits and these types of expenses, which she actually does, okay, she actually does, and the proof of it can be shown. Her mother also has a mobile phone, right? Right, that you got to pay the bill on, keep in contact with the medical offices, right? Mom might need a car, get back and forth to the doctor's appointments. You might too, right? You might too, right? They give you the information. This is the overarching entity. They're already saying, if you have any of this stuff going on, we don't mind to give it to you, but you got to tell us about it. All right. And that's where the person at the front end, like I'm telling you, the case managers that are incompetent or unqualified, disorganized and shit, don't bit more give two fucks about you. That's where they need to tell you that, like, okay, I just want to let you know that you won't get by law, and they need to tell you what the law is. Don't just put by law. We're not able to give you this. However, if you're able to demonstrate that you have additional expenses like XYZ, then we can consider it. We can definitely consider it. Okay. And then you can put in a request and we can get you your immediate turnaround directly to your bank account for additional 2,000 or something like that, or whatever, right? So yeah. Yeah, you can even use some to purchase a home. All right. All right. So make sure that you question everything. And if you put in a disability claim and it's taking very, very long for them to process it, even, you can outreach the senator and say, listen, I've had my claim in for XYZ. I haven't heard approval or denial yet. Boom. Okay. If you've heard approval or denial, you can send a subsequent. I'm not understanding this. I mean, you really need to put a hearing in if you have an appeal in if you have a denial. But if you've been approved and then you're just like, okay, where is the payment? And nobody, you sent in all your verification, if that's what they need. Me personally, I don't even know why they requested that of the young lady. Because I didn't have to do that with my kids. They didn't, because you're just a payee. You're just a payee. It doesn't matter. It doesn't matter what your income is. This is the child has a disability. The child has the issue. Your income really shouldn't matter if she qualifies for disability. I mean, I really don't know that part of it. I'm still trying to figure that out. But when I got that for my boys, they never asked for their Social Security after their dad died. They never asked me for my income and for me to send in a copy of the lease and for me to send in my paid stubs and all of that, because it doesn't matter. It didn't make a difference whatsoever what my income was. My income was. I don't know. Now I could see maybe sending in your expenses and all of that, but not your income, because they need to calculate how much you get. I mean how much the person gets. I don't know. I still got to figure that part out. But anyways, basically, I want to come on and give you this video. Just doing the journal, just running my mouth, for you to be able to better advocate for yourself. I'm going to go get me a coffee. And so there you go. Any questions, or if you want to make a comment, or if you've been through a situation that you want to share with somebody and you found something in your approach and how you did things to be beneficial for you, please share it. So, because that's what I'm trying to do. I'm trying to build a community. And I'm not going to be on this YouTube. all the time. I'm gonna make me a whole separate one, which I've already started. That's specific to my mission in life to serve unmet vulnerable populations with unmet social determinants and stuff like that, and people who fall on some type of hard time or crisis that's unforeseen. I'm developing a whole YouTube page specifically for that. This one is my complaint page, and where I'll be out with people and talking about them and telling nothing but the truth and absolute truth, and letting you know what it really is behind the scenes. Half of them's really lying and shit like that. And it makes me mad too, because I'm like, how are they getting all this money and all this capital, but really they're not serving the needs of the community and people being deceived, really. And I thought it was all about trying to ensure that people were in a better position in life. They were able to have a quality of life. You're trying to decrease their level of stress in their instance of going into some type of mental health crisis or situation, get the burden off their back that causes all this shit. Telling them lies at the damn Social Security office and shit like that. I mean, you don't sit up here and tell me you need my fucking monthly pay stubs every month to determine how much my child is going to get for Social Security. That's not good. That's a whole lie. Yeah, and I'm about to turn that bitch in too, because it made me reflect back on it when I was just sitting here thinking about it. All right, it's not true. All right, so have a good day.